which is the most common one, ABO system and RH system or rhesus system. Those are the most important and most commonly used blood groups from clinical point of view. Okay, however, there are more than 300 blood group systems, but we won't be considering all of them. The ones that are important to us are the ABO blood group and the rhesus or RH blood group. Okay, so there are antigens or agglutinogens that are present on the RBC surface, and blood grouping is based on the type of antigens that are present. Okay, so this ABO system that I was talking about, it was discovered by someone known as Karl Landsteiner in 1900. Okay, now you have to remember this name because you will be asked what is Landsteiner's law? Who discovered ABO system? You have to remember that it was Karl Landsteiner. And what happens is the red blood cells contain different types of antigens or agglutinogens on the surface, whereas plasma contains antibodies or agglutinins. Okay, so antigens are present on the surface of RBC, whereas antibodies are present in plasma. Right? So, okay, now what happened? One moment, okay. So now let's talk about Landsteiner's law. What is this Landsteiner's law? So if an antigen is present on a patient's RBC, the corresponding antibody should not be present in patient's plasma under normal condition. Okay, this is known as Landsteiner's law. So what does it state? It states that if suppose you have an antigen on your RBC, then the corresponding antibody should not be present in your plasma. So if you have A antigen, then you won't be having A antibody. Okay, the person who has A antigen will not have A antibody in the plasma. Likewise, if the person has B antigen, then he won't have B antibodies in the plasma. Okay, basically this is what is stated by Landsteiner's law. If an antigen is present on a patient's RBC, the corresponding antibody must be absent in the patient's plasma under normal conditions. So there are some abnormal conditions, for example, mismatched blood transfusion or something like that. Only then the corresponding antibody can be present. Otherwise, in normal conditions, it is not present. Okay. So this is the basis of ABO blood grouping. Now, what are the major ABO blood groups? So one is A, B, O, and AB. Okay, so A, B, O, AB. These are the ABO groups, major ABO groups. So what happens is when a when a person has blood group A, then he will have A antigen on the surface of his RBC. Okay, and he won't have B antigen, obviously. And the antibody that is present in plasma is anti-B antibody. So according to Landsteiner's law that I mentioned before, if an antigen is present on the patient's RBC, on the person's RBC, then he won't have the corresponding antibody. Okay, so he won't have anti-A antibody. If the person has A blood group, he won't be having anti-A antibody, he will be having anti-B antibody. So it's the same. If the person has B blood group, then the antigen that is present on the surface of his RBC will be B antigen, and the antibody that is present will be anti-A. And if the person has O blood group, then he is not having any antigen or agglutinogen on the surface of his RBC. So O blood group is also known as universal donor. Okay, so the O blood group won't have any antigen present on the surface of RBC, and the antibody that will be present is both anti-A and B. Right, and talking about AB, if you have AB blood group, then the antigen that is present on your RBC will be both A antigen and B antigen. Okay, and the antibody that is present in your plasma will be none. Because according to Landsteiner's law, if you have a certain antigen, you won't have the corresponding antibody. Okay, I hope this was clear to everyone. So this is about the ABO blood group. Okay. So now let's move on to how to practically determine the blood groups. So there is slide method and tube method. In our physiology practical lab, we'll be using the slide method to do blood grouping. Okay. So actually tube method is a better method, but it takes longer. Okay, so usually in tube method, blood sample is taken in tube with an anti-serum. Okay, then it is incubated, it is centrifuged, and finally it is examined both macroscopically and microscopically for agglutination. Okay, but we do not do this method in our lab. What we do is known as slide method. Okay, so you are aware of what glass slides are, right? So there are certain glass slides that are used for this. So actually 3 slides are used in our lab. So you'll also require antibodies or anti-sera A and anti-sera B. Okay, and also you'll require blood samples. So first, let's look at one video and I'll again explain to you the process. So first, let us look at this video, okay? One moment. Right. Wait, are you able to hear? I don't think you're able to hear. Wait, I did not share system audio. One moment. Are you able to hear the sound?
Yes, ma'am.
Yes, ma'am.
Okay, good.
Today we perform determination of blood groups. There are more than 30 blood group systems. The ABO system is the most important of all blood group systems due to presence of natural A and B antigen in the individual, presence of the RBC, and lack of corresponding antibodies in plasma. So here we will perform blood grouping by ABO and RH system to determine presence of different antigens. Principle: RBCs contain different types of antigen, also known as agglutinogens, and plasma contains antibodies known as agglutinin. Red blood cells are allowed to react with commercially available agglutinin. To perform the practical, we require test tube, 0.9% normal saline, anti-sera A, anti-sera B, anti-sera D. Porcelain tile, slide with cover slip, dropper, and microscope. Procedure: take 2 ml of 0.9% normal saline in a test tube. Make a sterile finger prick and collect the sample into the test tube. Here we are using already collected sample of blood. Mix the solution to get red cell suspension. Now take porcelain tile and label it with anti-A as A, anti-B as B, anti-D as D, and control as Place few drops of sera accordingly. Anti-A in the tile bit written A, B, anti-B in B, anti-D in D, and red cell suspension in control. Add a drop of red cell suspension in A, B, and D. Mix it by gently shaking the tile and wait for 5 to 10 minutes. Check for agglutination and compare it with a control sample. You can see we get agglutination in B, not in any other. Place a drop of agglutinated sample on slide. Place cover slip and confirm your finding under low power in microscope. Observation: if agglutination is found in peat containing anti-A, the group is A. If it is in anti-B peat, the group is B. If agglutination found in both, the group will be AB. If no agglutination is seen in either, it is O group. If agglutination is seen in the peat with anti-D, the person is RH positive, and if not seen, the person is RH negative. In our practical, we get agglutination in B. Therefore, our blood group is B, and we couldn't find agglutination in D. Therefore, our blood group is negative, RH negative. Therefore, the blood group is B RH negative.
We can confirm the findings under low power of the microscope. If there is no agglutination, the RBCs remain separated and evenly distributed. You can see in the first diagram. And if agglutination occurs, RBCs are massed together in clumps and lose their outline. It is depicted in the second diagram. So this way we can confirm our finding.
Okay, so I hope everyone understood the procedure, but let me explain it to you. Okay, so what we do in our practical lab is we do not take the porcelain tile that was shown in the video. Okay, we just take glass slides. So first what we do is we take 3 clean glass slides, right? And we make a sterile finger prick with a lancet. Okay, and after making the prick, we place the drop of blood and mix it with the normal saline. 0.9% normal saline. Okay, about 2 ml of 0.9% normal saline is mixed with the blood drop. And after that, what is done is we place the anti-sera on each of the glass slides. So we have 3 glass slides, right? So we mark one of them A, another one B, and another one D. Okay, so on the one that is marked A, we place a drop of anti-A anti-sera. Okay, and then on the one that is marked B, we place a drop of anti-B anti-sera. And finally, on the one that is marked D, we place anti-D anti-sera. Then we wait for a while, about 2 to 3 minutes should be enough, sometimes about 5 minutes. Okay, and what we see is agglutination. So what is this agglutination? It is clumping of RBCs. Okay, so where do we see this agglutination? We see this agglutination on the antigen that is present on the RBC, right? Due to the antigen that is present on the RBC. So if your blood group is A, then when you place anti-A antibody and react it with your blood, then what happens is agglutination or clumping of cells happens. Okay, because normally in your body you would not have anti-A antibody. Okay, I hope everyone understands this. And if your blood group is B and you have mixed anti-B antibody with it, you will have agglutination on the slide or clumping on the slide. And it is the same with antigen D. So what is this D? We will be talking about Rh blood group as well. Okay, so D antigen is the one that is most prominently present when we are talking about Rh blood group. And it determines if you are Rh positive or Rh negative. If you have D antigen on the surface of your RBC, then you are Rh positive. If D antigen is absent, then you are Rh negative. That is why when anti-D serum is mixed with your blood and there is agglutination, then we should conclude that you are Rh positive. Okay, so let us see a picture. See, so this kind of clumping will take place. Agglutination or clumping will take place. This is the normal one where no clumping or agglutination has taken place. And this is where agglutination or clumping has taken place. Okay, so again, let us interpret our result. Okay, so agglutination with anti-sera A and not with anti-sera B means you are blood group A. Likewise, agglutination with anti-sera B but not with anti-sera A means you are blood group B. Agglutination with both anti-sera A and B means you are blood group AB. And finally, if there is no agglutination in any slide, then you are blood group O. Okay. Okay, so I would like to ask one of you. I don't know if you have understood this or not. Abhigya Acharya, can you turn your mic on and turn your video on as well?
Ma'am, I'm on desktop, so I don't have camera.
Okay, fine. So Abhigya, can you tell me, so you have placed anti-sera A and mixed it with your blood and you observe agglutination. Okay, but
Yes,
you do not observe agglutination on when you mix it with B anti-sera.
Yes, ma'am.
Right, and you also observe agglutination if you mix it with anti-D anti-sera.
Yes,
So what is your blood group?
A positive.
Okay, very good. So it is A positive. Okay, Abhigya. So I think you all have understood. So that is the method by which you determine your blood group in the lab. If there is any doubt, you can ask, okay? Okay. So let us see again another picture. So this blood sample A interacted with antibody A and there was agglutination observed. Right? Here the blood sample A positive interacted with antibody B and C, no agglutination or clumping is observed. So only when the anti-sera that is reacting with the antigen present on your RBC is there, only then agglutination is observed. Otherwise, it is seen like this. Okay. So, like I mentioned before, the universal donor is blood group O. Okay, because it does not have any antigen on the surface of RBC. So if your blood group is O, you should remember that there is no antigen that is present on your RBC. I'm talking about ABO blood group here. Okay, positive, negative, that is a different thing. So if you're O positive, you will have D antigen. However, when we're talking about blood group O, then under ABO blood grouping, you won't have A antigen or B antigen on the surface of your RBC. That is why you are known as universal donor, because now you can donate blood to any blood group. Okay, preferably whatever your blood group is, exactly that blood group should be given during blood transfusion. However, under emergency conditions, sometimes blood group O can be transfused to any blood group. So it is known as universal donor. Okay, and there is universal recipient, which is AB blood group. It has both A and B antigens present on the surface of RBC, and agglutination occurs in both as no antibodies are present in serum. So since no antibodies are present in serum, they are known as universal recipient. Okay. Now, RH typing, I'm sure all of you are aware that RH blood group is also one of the most commonly clinically used blood typing. It is second in significance after ABO system. It consists of over 50 related antigens. However, the most important one for us is D antigen. This D antigen is the one that determines whether you are RH positive or RH negative in clinical terms. Okay, so if you say that you are RH positive, then that means you have D antigen on the surface of your RBC. Okay. So RHD or D antigen is a strong antigen which is highly immunogenic, and other antigens are less antigenic than D. So they are of lesser clinical significance. And that is why when clinically we are talking about RH group, we are talking about D antigen. Okay, so in practice, RH negative and RH positive, it depends on presence of D antigen on the surface of red cells, which is detected by strong anti-D serum. Okay. So there is presence of D antigen in RH positive people, and it is the most common type of blood group. Okay, so 80% of the population is RH positive, or even more than 80% of the population is RH positive. That is why it is a bit difficult to find RH negative blood even during blood transfusion. Okay. And RH negative, so there is absence of D antigen, and there are certain other antigens as well, C, E antigen, etc., which are weaker antigens than D, and they are of less clinical significance. Okay. So I hope all of you have studied this. RH incompatibility, sorry, the spelling is wrong over here. So RH incompatibility, it results in something known as hemolytic transfusion reaction, in which there is massive hemolysis or destruction of the RBCs. So when RH incompatible blood, for example, RH positive blood is transfused on an RH negative patient or something like that, it does not matter much during the first time, but on subsequent transfusions, there is great chance of hemolytic transfusion reaction. And there's something known as hemolytic disease of newborn as well. Okay, especially in second, third pregnancy, etc. There is a chance of hemolytic disease of newborn, erythroblastosis fetalis. So you should learn this in theory, okay? Now, again, for RH blood grouping as well, the same techniques are used. So here in the lab, we use we determine ABO group as well as RH group at once. So like I said, we use 3 or 4 slides. Sometimes we place one more slide as control. Okay, just to compare it with the other slides. So that's how we do it. And in tube method, we do not do over here. So it's the same thing. So you place 1 drop of anti-D on the slide and you add 1 drop of blood. You mix it well with stick or stirrer. Okay, you wait for about 5 minutes and then you observe. So if you can see agglutination, it indicates RH positive blood samples. Right, so let us watch one more video. Okay, this is very important, so let's watch one more video. So it'll be very clear to you when you come to the lab and actually have to do the practical.
Hello everyone, this is a practical session of blood grouping. Principle of blood grouping, agglutination. Now what is agglutination? It's a reaction between agglutinogen and agglutinin. Here the agglutinogen means antigen and agglutinins means antibody. But in the blood grouping system, we are using the word agglutinogen and agglutinin instead of antigen and antibody. Apparatus for blood grouping. Pricking apparatus, which includes the spirit, lancet and cotton. 4 clean glass slides. You need 4 clean glass slides, normal saline, small test tube, dropper, and anti-sera preparations, anti-A, anti-B, and anti-D. These are artificially available anti-sera preparations. This anti-A solution contains agglutinin against agglutinogen A. This anti-B solution contains agglutinin against agglutinogen B, and anti-D solution contains agglutinins against agglutinogen D, means Rh antigen. So here we begins with the procedure of blood grouping. First of all, you have to fill about half of small test tube with normal saline, as you are seeing in the photographs. After that, you have to prick your finger with proper aseptic precautions. Now you have to add 2 to 3 drops of blood to the test tube containing normal saline. Take 4 clean glass slides and mark them A, B, C and D. Here the C word is we are using for the control. Put 1 drop of anti-sera solution anti-A, anti-B and anti-D in A, B and D slides respectively. So you have to put 1 drop of anti-sera solution anti-A in A number slide. You have to put 1 drop of anti-sera solution anti-B in B number slide, and you also have to put the 1 drop of anti-D solution in D number slides. Now with the help of dropper, add 1 drop of normal saline plus blood solution in all the slides. Now with the help of dropper, you have to add 1 drop of this solution. This solution contains normal saline plus blood in all the 4 slides. Means you have to add 1 drop of this solution in slide number A, in slide number B, in slide number C and in slide number D. Please remember that in the slide number A, there is a anti-sera A solution plus 1 drop of this solution. In the slide number B, there is a anti-sera B solution plus 1 drop of this solution. And in slide number D, there is a 1 drop of anti-sera solution anti-D plus 1 drop of this solution. Now gently shake your slides and wait for 10 minutes. You have to shake the slide gently so that the blood plus normal saline solution gets evenly mixed with the anti-sera solution. Now look for agglutination. If dust-like particles appear, then it's agglutination. Now look in this slide, which having a anti-sera A solution and blood plus normal saline. So you are able to find the dust-like particle in this solution, then it's a positive agglutination reaction is there. Now if you find this dust-like particles in anti-sera B solution, then there is also the presence of agglutination reaction in this solution. And if you are also going to find these dust-like particles in anti-sera D solution, then there is also the presence of
Okay, so I would like to ask AV Bravin Russell. Are you there? Can you hear me? Yes? Okay, I don't think he's there. Okay, Pratisma Wagle, are you there?
Yes, ma'am.
Okay, Pratisma, so if you find this kind of reaction when you're trying to find out what your blood group is, if you see that there is clumping in A, B as well as D, then what do you think your blood group will be?
AB positive.
Okay, good, Pratisma. Okay, so you will have AB positive blood group because you are seeing agglutination in all of the slides where you have added anti-A antiserum, anti-B antiserum as well as anti-D antiserum. Okay, good.
Ma'am, sound is not coming.
Sound is not coming.
No, ma'am.
From the beginning it wasn't coming or just now?
After the Pratisma answer question.
Okay, okay. One moment.
So this is the rouleau formation. These are the dust-like particles where the agglutinogens are present.
So are you able to hear now?
Yes, ma'am.
Yes,
Okay,
ma'am.
good. Okay.
Now, how to differentiate between agglutination and rouleau formation? When there is agglutination occurs inside some of the antisera solution, it looks like a dust-like particle. Look at this. These are the dust-like particles. When appears, our result will be positive, and that will be the agglutination reaction is present. The word rouleau formation, which means that RBC having a property of sticking to each other just like a stakes of coin. So this is the rouleau formation. Please don't confuse with the agglutination and rouleau formation. That's why we are using slide number C, where and in this solution there will be the rouleau formation. Slide number C, we must have to take to avoid the false positive results. So please don't confuse between the agglutination and rouleau formation. Agglutination means there is a presence of some or appearance of some dust-like particles in the solution. So slide number A, you are clearly find these dust-like particles. So agglutination is present. In slide number B, you are also clearly find these dust-like particles. So agglutination is present. In slide number C, here the slide number C only having the normal saline plus blood solution. So there is never presence of any type of agglutination in this slide number C. And in this slide number C only you will find the rouleau formation, means there is a property of RBC sticking to each other just like a stacks of coin. And this slide number C is must during the practical of this blood grouping to avoid false positive result. And in slide number D, there is also the presence of dust-like particles. That means that agglutination is present. So we did this practical and find that the person having a AB positive blood group, because there is a presence of agglutinogen A, agglutinogen B as well as RH agglutinogen. Clear? This table is most important to find out our result. That means that which blood group is present at the time of different type of agglutination occurs in the three type of antisera. In the persons having A positive blood group, you will find agglutination in antisera A solution as well as antisera D solution. In the persons of A negative blood group, you will find agglutination in antisera A solution. In the persons of B positive blood group, you will find agglutination in antisera B solution and antisera D solution. In the persons of B negative blood group, you will find agglutination only in the antisera B. In the persons of AB positive blood group, as we seen in my previous slide, we will find agglutination in all three antisera solutions. That means antisera A, antisera B and antisera D. In the persons of AB negative blood group, we will find agglutination in antisera A solution and antisera B solution. in the persons of blood group O positive, you will find agglutination reaction only in the antisera D. And in the persons of O negative blood group, you never find agglutination in any of these antisera solution because they don't have any type of agglutinogens, neither A nor B. So this table is the most important. Please note it down. Now, what is zone phenomena? For agglutination to occur, the agglutinogen and agglutinin concentration has to be the same. If it's not the same, then no reaction occurs. That's why we added 1 drop of antisera solution as well as 1 drop of normal saline plus blood solution. So that is the zone phenomena. Now, what is the use of blood grouping?
Okay, so by now I hope it is very clear to everyone about how to do the blood grouping practical. So if there is any doubt, you may ask. Okay, so I hope all of you will be able to do this practical when you come back. Okay, so we will conclude our class here today. One moment, I'll download your attendance.